The Ministry of Health and Childcare today received equipment and medicines worth $9 million, a boost set to strengthen the country's maternal and neonatal health. Through the Health Transition Fund, a pooled fund supported by the European Union, governments of Ireland, United Kingdom and Gavi, the commodities will be distributed across the country's public health institutions. The supplies included anesthetic machines, operating theatre tables and essential machines. We get more in this following report.
Adequate life-saving equipment and medicines are crucial in ending preventable deaths of women while giving birth. At least 5 women die each day in childbirth due to preventable causes.
Without supplies, without commodities, without medicines, we cannot prevent maternal deaths. We cannot meet the unmet needs for family planning. We cannot end gender-based violence and harmful practices. And we cannot end new infections of HIV and AIDS.
Through the Health Resilient Fund, the country targets to improve maternal and neonatal health outcomes. The Health Resilient Fund aims to end preventable maternal, newborn, child and adolescent deaths. It also seeks to enhance global health security and strengthening health systems. The United Nations noted saving lives of mothers and unborn babies was critical for development.
Every child, regardless of their background and circumstance, has access to quality health care and a chance to reach their full potential. As you know, maternal, newborn, and child survival depend crucially on the availability of essential medicines, on nutrition support commodities, and other life-saving equipment.
Implemented through the government, the fund is aligned to Zimbabwe's National Development Strategy 1 as well as the National Health Strategy 2021 to 2025. The government added that life-saving equipment was a critical asset in efforts to improve health outcomes.
The medical supplies and equipment we have received today worth over $9 million include a comprehensive mix specifically targeted at improving maternal and neonatal health outcomes.
More can still be done to improve the situation for women in the country. And the ball is in the country's hands to ensure this is sustained to save mothers and their babies. For ZTN Prime, I am Mirirai Nsingo.
Earlier on, Mirirai Nsingo caught up with the Health Resilient Fund co-chairperson Dumisile Msimanga to understand the significance of such pooled funds. She first highlighted that this is not the first of pooled funds that Zimbabwe has received. So, how significant is the fund to Zimbabwe's health system?
The Health Resilience Fund, just like the name does mention, it puts a lot of emphasis on resilience so that development assistance, external development assistance doesn't continue forever, but the sustainability that's built within the system. It was designed in such a way that while it supports the delivery of immediate services to the communities and to the people that are in needs, but it also builds capacity and strength within the system that in the passage of time we can then be able to exit out of the scene, and we know that the system is able to stand on its own and it doesn't roll back in terms of its results that have been achieved.
The co-chair also responded on whether Zimbabwe has so far witnessed any impact in the sector since the inception of the Health Transition Fund in 2022.
Yes, since the Health Resilience Fund, we started implementing it, we've seen results coming through in terms of continued delivery of services mainly to the mothers and the children, mainly in rural areas, including the hard-to-reach areas. But it must be put in context that it is not being implemented in a vacuum. The country has faced some challenges, like, for example, the emergencies that it has faced, the drought that we're currently facing, and all those things. If we are able to continue to facilitate the delivery of health services, basic health services, to the pregnant mothers, the children, the under 5s, and the babies, in this context, we are happy with the results, because otherwise, if this program was not in place, we're not working this closely with the Ministry of Health, we think that there will be some glaring gaps that we begin to see within the communities in terms of delivery of services.
Konapo Konapo, Ipapo pa ZTN Prime, DSTV channel 294, the place to be.